Welcome. My name is Michael Lucido, and I'm a physical therapist, and I am a teacher and instructor with the North American Institute of Orthopedic Manual Therapy, also known as NAIOMT. Today I'm doing a series of videos that will primarily be used for our online education. And I'm using these videos, as I call these, the best of NAIOMT, the best of the North American Institute of Orthopedic Manual Therapy, giving you a taste of some of our different theory and practice that would then give you a sense of where we're going as an institute and whether you'd like to join us or not. One of the dominant problems of the lower quadrant is what we call the psoas triangle. The psoas muscle is a muscle that actually starts at the thoracolumbar junction. It attaches to the anterior aspect of the transverse process as well as the intervertebral disc, attaches to all the lumbar spine segments, gives a slip off to the ilium, dives deep in front of the hip, and then dives deeper and attaches to the lesser tuberosity. That muscle is typically upregulated and in a state of hypertonicity with people that have mechanical back pain. And the reason why is because we feel like the lumbar spine is susceptible to what's called neutral zone instability. Neutral zone instability is a sense of a lack of viscoelastic property of the spine that the brain realizes, and then the brain recruits certain muscles to help stabilize it. And the psoas is one of the muscles that actually recruits. The problem is it affects the other parts of the anatomy because the muscle, it becomes very, very tight, and that can affect the hip. So one of our assessments is to actually look at the hip itself to see if the psoas is involved. So I'm going to assess Luke's right hip, just bending his knee and feeling hip flexion in a typical normal way, and that actually feels pretty good. Then I'm going to assess his left hip. And typically when we have a upregulated or hypertonic psoas, the patient will feel like their hip is not flexing very well at all, kind of like this one's doing. And the infeel or the feel of what's actually blocking it feels very much muscular. So the joint is not tracking properly. There's a sense that there's something blocking the joint. And many times we actually believe that the psoas in its state of hypertonicity is actually one of the problems. We can actually determine that quite quickly. I'm going to have Luke lie on his right side, and I'm going to go into an immediate muscle energy technique to relax the psoas. So by relaxing the psoas, I'm then going to go back and reassess the hip to see if the hip is moving better. So I'm going to place his left elbow just like this. The left psoas is actually a left side bender, so I'm going to resist left side bending of the spine by trying to push him into right side bending. He's now resisting me. 1, 2, 3, 4, 5. Very good. We're going to do it again. Resist. 1, 2, 3, 4, 5. And again. 1, 2, 3, 4, 5. That engages the left psoas when we do that. Now lie on your back for me. And many times we'll be able to then take the left hip or the ipsilateral hip, whichever one we worked on, or release the psoas by doing a contract relax, and you'll notice an immediate significant movement of the hip. And when we feel that, we know that the psoas is the reason why the hip is not flexing properly. So we then go into the spine and start looking for evidence of neutral zone instability, which would then explain why the psoas is in a state of hypertonicity or in a state of upregulation.